Hello, everyone, and welcome to this training webinar on 508 compliance for health assessors, creating accessible Word documents. My name is Rebecca DeVries, and I'm an environmental health scientist with Eastern Research Group. I will guide you through this training on behalf of the Agency for Toxic Substances and Disease Registry, or ATSDR. The content of this webinar was developed with Sandra Lopez Carreras, health scientist and training coordinator, and David Millard, associate director of science, both of whom are with ATSDR's Office of Capacity Development and Applied Prevention Science, or OCDAPS. Today, I will provide an overview of best practices to increase accessibility when preparing documents, such as public health assessments or health consultations. At a later date, ATSDR will offer additional training during which you'll learn how those practices are actually implemented within a Word document. Both sessions will be recorded and made publicly available so that they can be viewed by you and others in the future. At the end of this presentation, David Millard and Sandra Lopez Carreras, along with Tanya Burke and Lee Moore from ATSDR's Office of Community Health Hazard Assessment, as well as Michelle Natali from ATSDR's Office of Communication, will be on the line to answer your questions. During this webinar, I will present a series of slides focused on how to increase accessibility in electronic documents. I will provide background information on Section 508 and accessibility so that you can understand why accessibility benefits everyone. Describe why accessibility is important to your work and the documents you create. Summarize best practices for developing accessible public health documents in Word, such as public health assessments, health consultations, and letter health consultations, and introduce you to several related tools and resources. To begin, I will provide a brief overview of Section 508 and how it aims to address accessibility. To do so, we have to go back to the Rehabilitation Act of 1973. This federal law prohibits discrimination on the basis of disability for programs conducted by federal agencies or that receive federal funding. It was one of the first major legislative efforts to secure equal rights for individuals with disabilities in the United States. The act has been updated several times. Most notably and relevant to this webinar, Congress updated this act in 1986 to include Section 508, and then again in 1998 to issue the first set of standards and guidelines for Section 508. Section 508 specifically requires that federal agencies make all electronic and information technology, or EIT, accessible to people with disabilities, including federal employees and members of the public. It applies to all public-facing electronic and information technology. Examples of EIT include documents in both PDF and Word format, presentations such as PowerPoint slides, spreadsheets, videos, websites, web applications, and desktop software. Section 508 ensures that everyone has equal access to and use of EIT created with federal funds. People with disabilities have sensory, physical, or cognitive impairments that limit their ability to perform one or more major life activities. These types of disabilities can vary from mild to severe. Impairments that are addressed by Section 508 include blindness or visual impairments, such as color blindness, deafness or hearing impairments, such as those requiring the use of assistive hearing technologies, difficulty with speech, difficulty with fine motor control, and limited reach or strength. Importantly, you should never assume that your audience is not affected by any of the disabilities shown here or covered by Section 508. This webinar specifically focuses on Section 508 requirements and guidelines for electronic documents. An accessible electronic document is designed, structured, and written in such a way to ensure that it can be effectively used by anyone, including people with visual, cognitive, and hearing impairments. This ensures that all audiences are able to receive and understand the same information within a document, including those who may be using assistive technologies such as a screen reader or screen magnifier. There are many things that can be done to ensure that a document is accessible to everyone. For example, you could check the colors used to make sure that there is sufficient contrast for those with low vision or who are colorblind. This is particularly important when color is used to convey meaning that would otherwise be missed. As another example, you could add descriptions to images or figures within a document. This would allow a person who is blind and using a screen reader to receive the same information as someone who is able to see the image. You could also format a table so that a screen reader will read the information aloud in a logical order, allowing a listener to understand the content of that table. And as a final example, you could structure a document using the headings and styles features in Word to ensure that a screen reader reads the information in the right order. This also allows users to navigate the document by voice or keyboard. If a document is not developed with these types of accessibility features in mind, individuals with disabilities may not be able to readily access and understand the information. But also, these types of considerations are required by law. I have mentioned screen readers several times now, and this will continue to come up throughout the rest of this webinar. As such, and before we continue, let's talk briefly about what a screen reader is and why it is used. A screen reader is a software program that allows people with certain disabilities to use computers or read documents by converting virtual information or digital text into speech or braille. This includes people who are blind, have low vision, or have cognitive or learning disabilities. Screen readers may also be used by people who are reading content as a second language learner. The software works by interpreting words on a page and then converting that information to a computerized voice, which reads the information aloud. There are numerous screen reader software programs available. On this slide, I am simply showing you 3 examples without endorsing any particular one on behalf of ATSDR. Job Access with Speech, or JAWS, is available on Windows computers and requires a paid annual license. Non-Visual Desktop Access, or NVDA, is a free and open source program with both Windows and Apple compatible versions. VoiceOver is the default screen reader on all Apple devices, though it's also available on Windows computers. To provide an example for how screen readers work, I have an excerpt from a recently published health consultation, which is shown on this slide. I used the software program NVDA to create an audio recording to show how that screen reader would read this text aloud. Here is what this would sound like to someone using this tool.
An evaluation of site-related environmental contamination consists of a 2-tiered approach: 1. A screening analysis, and 2. A more in-depth analysis to determine public health implications of site-specific exposures.
The screen reader reads the text exactly as it appears on the screen, as we expect. When working with other elements in a document, however, such as a table or a list, you have to take certain steps to make sure that a screen reader will read the information in an appropriate and logical way. Otherwise, the information conveyed to the listener may be meaningless. We'll talk more about this later. Before we move on to the next section of this webinar, let's pause briefly and review some of what we just learned through a quick knowledge check. For this, consider the following question. What are some examples of ATSDR materials or products that need to be in compliance with Section 508 of the Rehabilitation Act of 1973? I'll give you some time to think about possible answers. Okay, here are some examples of electronic and information technology that ATSDR needs to make accessible to all audiences. PDF documents posted on ATSDR Internet, electronic spreadsheets, videos posted on CDC's YouTube, ATSDR web pages, and desktop software. Moving on, now let's discuss why all of this is relevant to you and the work you do as a health assessor, either within ATSDR or through an apple tree state. If you've not heard the term apple tree before, It's ATSDR's cooperative agreement program with state health departments to conduct public health assessments at hazardous waste sites. AppleTree stands for ATSDR's partnership to promote local efforts to reduce environmental exposure. As I stated earlier, Section 508 of the Rehabilitation Act requires that federal agencies make all electronic and information technology accessible to people with disabilities. This means that all electronic content developed and published by ATSDR or other federally funded programs must be accessible to all users and audiences, regardless of disability. Electronic content includes websites, web or desktop applications, multimedia, and electronic documents. We'll focus entirely on documents today, and that is because we want you to learn how to make public health documents 508 compliant as you write them. Per Section 508, ATSDR must prepare and publish the results of public health evaluations in accessible documents, or as 508 compliant PDFs. This includes documents such as public health assessments, health consultations, and letter health consultations. To do so, health assessors and 508 coordinators within ATSDR engage in an iterative process, beginning with a final or cleared Word document and ending with a 508 compliant PDF that can be published to ATSDR's website. The iterative process arises when ATSDR's 508 coordinators need to circle back to the health assessors to address specific accessibility issues. However, this back and forth can be minimized by taking simple steps when the Word document is being written to increase accessibility. When the accessible Word document is then ultimately converted to a PDF, there is less work needed to make that PDF 508 compliant. To illustrate that process, this slide presents a flowchart outlining how documents developed by health assessors from AppleTree states ultimately become 508 compliant PDFs on ATSDR's website. Health assessors in ATSDR's Office of Community Health Hazard Assessment, or OCHA, follow the same general process shown here, though some of the steps involve a different group of people at ATSDR. The process starts with a final or cleared document from ATSDR's e-clearance. After clearance, the health assessor, in this example from an AppleTree state, prepares a draft 508 compliant version of the Word document, following the best practices for addressing accessibility discussed in this webinar. The health assessor then passes the document to the Technical Project Officer, or TPO, in the Program Services section of OCDAPS at ATSDR. The TPO forwards it to the 508 coordinator in the Office of Policy, Partnership, Evaluations, and Communication, or OPEC, in OCDAPS, who adds a title page and all of the necessary disclaimers. The 508 coordinator also prepares an initial draft 508 compliant PDF and sends it to the NCEH ATSDR Office of Communication, where the final 508 compliant PDF is created. During these initial steps, the document can go back and forth between the different groups to resolve 508 issues. This is the iterative process that I just mentioned for ensuring the final PDF is 508 compliant. Returning to where we were in the process, the Office of Communication then provides the final PDF, which is now 508 compliant, to the 508 coordinator, who passes it back to the TPO and then to the AppleTree state. As a final step, the Office of Communication and the AppleTree state coordinate the release of the 508 PDF, and the Office of Communication places the 508 PDF on ATSDR's Public Health Assessment website. Typically, this entire process takes between 3 and 5 weeks. However, it can be extended or delayed significantly if there needs to be a lot of back and forth between the health assessor, the TPO, and ATSDR's 508 coordinator or Office of Communication. Addressing key accessibility issues as the Word document is developed can help streamline and speed up the process for producing a final 508 compliant PDF. In summary, ATSDR must prepare PDFs that comply with 508 regulations. ATSDR can streamline creation of 508 compliant PDFs if proactive steps are taken at the Word document stage. Doing so helps limit back and forth communication between health assessors, TPOs, and ATSDR's 508 coordinators, and reduces the overall time needed to finalize and release a 508 compliant PDF. But also, and perhaps most importantly, taking steps to make your products accessible for everyone, including individuals with disabilities, should be integral to all aspects of your work. Before we continue, let's pause here again with another knowledge check. For this, determine if the following statement is true or false. Federal agencies like ATSDR are the only ones responsible for making electronic information accessible to everyone. Take a few seconds to think about the answer. Okay, the correct answer is false. If electronic information is being created using federal funds, it must be accessible and comply with Section 508 standards, regardless of the agency or program developing it. Thus, public health documents created through ATSDR's Apple Tree program must be 508 compliant. Let's go through another. Like the previous slide, determine if the following statement is true or false. We should always assume that at least some members of our audience are affected by a disability addressed by Section 508. Take a few seconds to think about your answer. Okay, the correct answer is true. Section 508 covers disabilities such as visual, hearing, speech, fine motor control, and reach and strength impairments. These disabilities may not be apparent, so it's important to always create electronic and information technology that is accessible to everyone. As a reminder, and before we proceed, health assessors should prepare an initial 508 Word document from a finalized and cleared public health assessment, health consultation, or similar document. ATSDR's TPOs, 508 coordinators, and Office of Communication review the document and then use it to create a 508 compliant PDF for public release. In this part of the presentation, I will go over best practices for health assessors when creating the Word document. To fully understand all aspects of Section 508 and accessibility for electronic documents, you would likely need to take multiple courses over several hours. However, a few basic principles can significantly improve the accessibility of every document that you create. Today, we will cover the overall structure of a document, font, color, use of alternative text, figures and images, tables, equations, hyperlinks, lists, and columns. Let's start with the general structure of a Word document. Section 508 compliance depends on the clear hierarchical organization of content within documents. This structure helps users, including those with disabilities, to effectively navigate content, understand relationships between different elements, and access information. Well-structured documents support assistive technologies such as screen readers, which rely on that organized content to accurately convey information. Additionally, they facilitate easy conversion to other formats, such as PDF, while preserving accessibility. You can use Microsoft Word's built-in features to help define the structure of a document. This includes features such as headings, styles, tables, lists, columns, and more. Let's start with headings. Headings are names or labels in a Word document that are used to break up content and make it easier for the user to find information. While you could use individual formatting elements like bolded or underlined text to identify headings, this type of formatting alone doesn't convey any meaning to assistive technology. Instead, and to assure accessibility, you should use Microsoft Word's built-in styles to create headings. This develops an underlying structure in the document that assistive technology can easily interpret. To do so, you navigate to the Home tab in the navigation window, and then go to the Style section and select a style from the gallery. You can either select the style first and then type the heading into the document, or you can type the heading or text first, and then with the cursor on the same line, select the style that you would like to apply. When using heading styles, you should apply them in numerical order, following the hierarchical structure of your document. If your document contains multiple heading levels and each level is visually different, you must assign a different style to each heading level. You also need to apply a new style for each heading that is different from that of the main body text. Finally, you can and should specify a unique format, including the font type, font size, and margins for each heading style in your document. This will allow you to achieve the desired look and feel of your document while also ensuring that assistive technologies can access and interpret the overall structure. Good news is that ATSDR has developed an outline for public health evaluation documents, which is available on the resources page of the Public Health Assessment Guidance Manual, or FAGM. This outline is already formatted with words heading styles, helping to ensure that the document created from that outline will be accessible to everyone. I'll tell you more about this later in the presentation. Another key factor when it comes to accessibility is the font. For electronic content, you should use fonts in the sans serif family. These fonts are generally clearer and easier to read on screen, especially for individuals with visual impairments, compared to serif fonts like Times New Roman. Serif fonts have small flourishes, or serifs, at the tips of each letter, which can make them difficult to read on screen. Sans serif fonts do not. Examples of sans serif fonts that are commonly used include Arial, Calibri, Helvetica, Tahoma, and Verdana. ATSDR recommends using Calibri font in size 12 point. You should avoid Calibri Light or any other light font, though, which may be difficult to read. While screen readers generally handle regular text well, regardless of the font, how they render other types of content can be unpredictable. Specifically, screen readers do not recognize all symbols. Examples of symbols that screen readers might not interpret correctly include the tilde, single or double angle brackets, and the section sign. If a screen reader does not recognize a symbol, it will either skip over it entirely or read the sentence incorrectly. For this reason, you should try to avoid using any unnecessary symbols that could make the text unreadable. If you absolutely must use such a symbol, you can tag it with a description, which is referred to as alternative text or alt text, which would be read aloud by assistive technologies. We'll talk more about this later. Another important consideration is the color used in the document. For people with color blindness, text becomes inaccessible when there's not enough contrast between the color used for the text and the color used in the background. This difference is measured by the color contrast ratio, which ranges from 1:1, indicating no contrast, such as white text on a white background, to 21:1, indicating maximum contrast, such as black text on a white background. For electronic documents, all content should achieve a color contrast ratio of 4.5:1 or greater. This ensures that the text is still readable to those who may have color blindness. Let me show you a few examples. On this slide, the text reading Test 1 appears as a light blue font against a white background and has a color contrast ratio of 2:1. Test 2 appears in a slightly darker shade of blue with a color contrast ratio of 4:1. Test 3 appears in an even darker shade of blue font with a color contrast ratio of 9:1. Of these examples, the Test 3 font color exhibits the greatest contrast with the white background. As far as which of these is accessible, the colors used for Test 1 and Test 2 do not achieve the minimum contrast ratio of 4.5:1. The color used for test 3, however, does, and is the only color that would be considered accessible in this example. There are numerous tools available for checking color contrast. On this slide, I'm showing you 2 examples among many. This is not an endorsement of any specific tool on behalf of ATSDR. Web Accessibility in Mind, or WebAIM, is a free web-based tool that calculates color contrast ratios based on foreground and background colors provided by the user. The Color Contrast Analyzer is available as a free download for Windows or Macs and offers the same functionality. Both tools support manual color input or the use of a color picker tool. To the extent possible, you should always check color contrast when preparing your Word document. ATSDR's 508 coordinators will also check this. It's also important to consider how color is used in figures. Color is commonly used to distinguish data and categories in charts and graphs. However, without clear labels or other distinguishing features, these figures can be hard to interpret for individuals with color blindness or low vision. To ensure that figures are accessible to everyone, color should never be used alone to convey meaning. Instead, charts and graphs should include labels or explanatory text to ensure they are understandable by someone who's not able to distinguish the colors. For example, on this slide, I am showing a pie chart with 3 colors, gray, green, and blue, that correspond to 3 groups, cadmium, arsenic, and copper. Individuals unable to see the colors may find it difficult to identify the corresponding categories, hindering their ability to interpret the results. Adding labels or explanatory text within the pie chart provides a solution. The text labels shown now reinforce the color's meaning, ensuring that users do not have to rely solely on the gray, green, and blue colors to understand the results. You can also use a combination of colors and patterns to help distinguish categories in graphs and charts. When using colors to convey a message, always include an additional method to ensure the message is understood. For example, URLs or web links are often underlined and displayed in a different color. This dual approach effectively indicates that it is a URL. We'll talk a little bit more about formatting URL hyperlinks later in this presentation. Continuing on the topic of images, figures, and graphics, you need to consider several other factors related to accessibility when including them in a document. First, you should only use images when they clarify or enhance meaning. Images that do not serve a meaningful purpose can be confusing or distracting when they're described by screen readers, disrupting a user's understanding of the content. Next, you should opt for high-resolution images whenever possible. This helps ensure that details and figures are clear and distinguishable, which is crucial for individuals with visual impairments who may need to use a screen magnifier to zoom in on the content. You should also ensure sufficient color contrast. Clear color contrast improves text visibility against background colors, making content readable and accessible to everyone. And finally, you must provide descriptive alternative text, or alt text, for all non-decorative images, figures, and graphics. We'll talk more about this over the next few slides. Alt text is descriptive text that provides the meaning or context of an image. Alt text makes visual content accessible to people with visual disabilities. It is a description that is read aloud by a screen reader. Without alt text, a screen reader may skip over an image entirely or simply read the image file name, neither of which is very informative. With alt text, however, a screen reader will read aloud a description of the information conveyed by the image. Alt text is needed for all non-text objects in Word that convey meaning. Examples include images, charts, icons, shapes, videos, audio clips, and equations. Additionally, alt text should be provided for tables. In general, alt text should be a short, concise description of the object. ATSDR specifically requires that alt text be no more than 120 characters, including spaces and punctuation. If the object needs a description in its alt text that is longer than 120 characters, it will need to be in an addendum of the public health assessment document. We'll talk more about that in a bit. Alt text is added to images in either Microsoft Word documents or PDFs. Whether adding alt text to a Word document or a PDF, it's crucial to assess if the image conveys essential information that needs to be accessible to users relying on assistive technologies. If the image is meaningful, it needs to be tagged with alt text so that a screen reader will provide a description of that image. If the image is decorative, it needs to be identified as such. In this way, a screen reader will know to skip over the image when reading out the content. If tagged as decorative, the screen reader will not read out a description or file name for the image, effectively treating it as non-essential content. This helps keep the focus on meaningful content and avoids unnecessary interruptions for those using assistive technologies. For context, one way to do this in Word is to right-click on the image, such as the ATSDR logo shown on this screen, and then select View Alt Text. A new pane will open to the right side of your window titled Alt Text. I have provided a screenshot of that alt text pane on this screen. Once the pane appears, a description of the image or the alt text can be entered into the text box. Alternatively, the image can be flagged as decorative by checking the box on the lower left. When preparing a final 508 PDF of a public health document, ATSDR's Office of Communication will add alt text to images, figures, and tables. However, health assessors need to provide the alt text to the Office of Communication. To do so, create a separate Word document with a list of all the tables, figures, images, and equations from your public health document that require alt text. As part of this process, make sure that each of them is numbered, such as Figure 1, Table 1, or Equation 1. If any are not numbered, assign them numbers before moving on. How you add alt text to this separate document depends on the number of characters needed to describe a given image. Remember, in most cases, ATSDR requires alt text to be 120 characters or less, including spaces. If a description for an image is 120 characters or less, including punctuation and spaces, type the alt text in that separate Word document. If a description must exceed 120 characters, you will need to take 2 steps to provide the alt text. First, type See Addendum in the separate Word document. Then, return to your public health document and create an addendum after the appendices, and type the alt text for the image into that addendum. This 2-step approach ensures accessibility for screen readers users, while also allowing you to describe an image with more detail, when that additional level of detail is necessary. Remember, alt text that's greater than 120 characters cannot be added directly to the table, figure, or equation. Instead, and using this approach, the assistive technology will have to go to the addendum to read the alt text. Importantly, addenda should be reserved for alt text and not confused with the appendices that are included in public health documents. Now, I realize at first this might be confusing, so let me restate it briefly. Instead of adding alt text to each table, figure, or equation in your Word document, you will create a separate Word document that lists each table, figure, or equation and its alt text. For alt text with greater than 120 characters, you will add See Addendum for alt text. You'll create an addendum in your public health document where you then list the table, figure, or equation along with the alt text that has more than 120 characters. Let's look at an example. This slide presents an example list prepared by a health assessor to provide alt text for a hypothetical public health assessment. For simplicity, assume that public health assessment only includes 3 figures. There are no other images or tables requiring alt text in the document. The health assessor therefore creates a list with the 3 figures and uses this to provide the alt text. The first two figures can be described in 120 characters or less, while the third cannot. For figure 1, the health assessor notes that alt text contains fewer than 120 characters and then types the alt text, which in this case reads, location of 10 surface soil samples collected across a residential property in 2016. For figure 2, the health assessor notes that the alt text contains fewer than 120 characters and then types comparison of soil sample results collected in 2006 and 2016. For figure 3, the health assessor determines that they can't sufficiently convey the figure's meaning in 120 characters or less. They note that the alt text contains more than 120 characters and then types "See addendum" into the list for figure 3. They then return to their public health assessment document and add an addendum containing the alt text for figure 3. The health assessor provides this list of figures with alt text as a separate Word document to the 508 coordinator. They also submit the public health assessment to the 508 coordinator with the addendum containing the alt text for figure 3. ATSDR's Office of Communication then uses the separate Word document and the addendum to add the necessary alt text to the figures when they create the 508 PDF version of the public health assessment. Before we continue, I'd like to quickly step through how you can check the character count for alt text in Word. You can do this using Microsoft's Word Count feature. Highlight the text you would like to count. Navigate to the Review tab at the top of the screen and click Word Count. Upon doing so, a pop-up window titled Word Count will appear. Check the count next to the description that reads characters with spaces. In this example shown on the screen, I entered the text location of 10 surface soil samples collected across a residential property in 2016 into Word and found through the Word Count feature that this text contains 76 characters with spaces. Since this is less than 120 characters, I would type this alt text directly into the separate Word document with figures, tables, and equations that I prepared for my public health document. I've now talked a lot about the importance of meaningful alt text. Here, I will step through some key do's and don'ts when writing alt text. When writing alt text, you should craft the text so that it provides the purpose and intent of the image. The goal is to provide enough information so that someone who cannot see the image understands its intended message. Additionally, you should use clear and concise wording. ATSDR requires alt text to be no more than 120 characters, so you have to be concise. On the flip side, there are several things you should avoid. Do not include unnecessary or redundant information that's already been provided elsewhere in the document. Also, don't use phrases such as figure of or image of in the alt text. Lastly, refrain from using the Generate Alt Text for Me option in Word. This text is generated through artificial intelligence and is often wrong. You should always try to write your own meaningful descriptions for tables, figures, and equations. Here's an example of alt text assigned to a figure in a public health assessment. The figure is a time series plot. It shows changes in blood concentrations for 4 PFAS measured in the general US population. While we certainly can't describe all of the details of this figure in 120 characters or less, we can convey the intended meaning of the figure for the document. In this case, the alt text could be written as time series chart showing market declines in US blood levels of PFOS and PFOA since 2002, when they began being phased out. This description is 118 characters, including spaces. Here's another example from a different health assessment. The figure is a map showing sampling locations near a channel with some nearby features, such as a residential area. The alt text could be written as location of 5 sediment samples collected in 1991 near Douglas Harbor in the front of the residential area. This description is 108 characters, including spaces. Moving on to tables. Tables are used to organize content, text, and numbers in documents. To ensure accessibility, tables should be structured to maintain a logical reading order and clear relationships between elements. This allows users of screen readers to navigate tables and comprehend the information within them more easily. One way to maintain structure is to use Word's built-in table feature to create tables within a document. You should always create tables this way, rather than inserting images or screenshots or tables, or manually using spaces to develop a table. Those methods will result in a table that can't be interpreted or navigated by users of screen readers. To add a table in Word, navigate to the Insert tab in the navigation window and select the table icon. A dialog box will appear. You can use your mouse to visually select the number of columns and rows needed for your table, or you can select Insert Table and enter the number of columns and rows there. After clicking OK, an empty table will be inserted into the document. You can then populate that table directly in the Word file. When you use Word's built-in table function and format it correctly, screen readers and other assistive technologies will read the information aloud in the correct order. As an example, I will now play a recording of the NVDA software reading the first two rows of the table displayed on this slide.
Table 1. Screening summary for contaminants detected in drinking water. Table with 3 rows and 5 columns. Row 1, column 1, analyte name. Column 2, maximum, ppb. Column 3, drinking water, CV, ppb. Column 4, CV source. Column 5, retin for further evaluation. Row 2, analyte name. Column 1, perchloroethylene, PCE. Maximum, ppb. Column 2, 17.0. Drinking water, CV, ppb. Column 3, 12.0. CV source. Column 4, CREG. Retin for further evaluation. Column 5, yes.
The screen reader announced the overall structure of the table and then read the content in a logical order, from left to right and then top to bottom. Importantly, the screen reader announced the column and row number that it was reading from, as well as the column heading. The same information would be read aloud if someone were to manually navigate through the table. There are several key considerations to creating an accessible table in Word, similar to the one shown on the previous slide. Once you've created a table in Word, it's important to identify the header row. Without this, a screen reader will not announce the content of the top row as the assistive technology describes each row, making it difficult for visually impaired users to follow the information. To identify the header row, highlight the first row of cells, go to the Layout tab in the navigation window, and click Repeat Header Rows. The row won't change visually, but it will now be recognized by assistive technologies as the header row. You can also identify header rows another way, by highlighting the first row of cells, right-clicking and selecting Table Properties. A pop-up window will appear. Navigate to the Row tab and check the box that says Repeat as Header Row at the top of each page. To create accessible tables, you should always try to use a simple format. A simple table has cells that rely on row or column headers to describe their content. Simple tables do not have merged or split columns, rows, or headings. They maintain clear relationships between header and data cells, making it easy for a screen reader to convey information in the correct reading order. In contrast, complex tables have multi-level headings or merged and split cells, which are not compatible with all assistive technology software. You should ensure that there is text in every cell of the table. This might mean that you need to go back and enter NA or a dash into empty cells. And finally, similar to images and graphics, tables should have alt text descriptions. Assistive technologies will read the table caption and header aloud. Therefore, when creating alt text, you'll want to explain the purpose of the table, rather than repeat text from the table caption or header. For public health documents, you'll need to provide the alt text for tables in the same separate Word document that you prepare to provide alt text for the images, figures, and equations in the document. ATSDR's Office of Communication will add this alt text when preparing the final 508 PDF. However, for context, I'll quickly show you how alt text is applied in a document. To add alt text to a table in Word, right-click on the table and select Table Properties. Then navigate to the tab for alt text and enter the description into the text field that is 120 characters or less. Now I'll show you an example of an inaccessible table. On this slide, I have included a table with hypothetical data from a health assessment of two chemicals, trichloroethylene and tetrachloroethylene. The table displays estimated doses, ATSDR's minimal risk levels, or MRLs, effect levels, and health effects for two groups, children ages 1 to 2 and pregnant women. This serves as an example of an inaccessible table because two of the rows have merged cells. While these rows visually indicate subheadings for sighted individuals, assistive technologies won't be able to read this information aloud in a logical sequence for those with visual impairments. This slide presents the same information but organized differently, as a simple table. Unlike the previous slide, where rows were merged to indicate the chemical, this version of the table includes a new column specifically for that information. This reformatting results in a simple table with a single header and no merged cells. Users of assistive technologies, such as screen readers, will find it much easier to access the information. This is an example of an accessible table. Accounting for accessibility of tables in the Word document stage will reduce the amount of time needed to prepare a 508 compliant PDF. Creating tables in a simple format, for example, prevents the need for having to reformat a table after the document has been cleared. This type of proactive approach saves time and ensures accessibility from the outset. Another important topic for accessibility is hyperlinked text. Public health documents may include links to other parts of the document or to external websites. All such links should be formatted as hyperlinked text in Word. When formatting hyperlinked text, the title should be clear and describe the destination, function, and purpose of the link. This is crucial for accessibility, since screen readers can generate lists of links from a page. Meaningful names are essential since generic names like "click here" will make it difficult for users to distinguish between those links in a list. The hyperlink text should also be a different color than the surrounding text and underlined. Both formatting features are required to ensure the link is accessible to everyone. Here are two examples. The first says, "To learn more, click here," and the words "click here" are shown as a link in blue font. The second says, "To learn more, refer to ATSDR's benzene tox profile," and the words "ATSDR's benzene tox profile" are hyperlinked and shown in underlined blue font. The first example is not accessible. It fails to indicate the link's destination or purpose and relies solely on color for identification. The second example is accessible. It informs the user that the link goes to ATSDR's tox profile for benzene. It is identified with a different color than the surrounding text, and it is underlined. To add an accessible hyperlink, you can use one of several link functions in Word. Suppose you need to add a link to ATSDR's tox profile for benzene. First, type or copy and paste the link into your document. Then highlight the text, right-click, and select Link. Note that if Word has already recognized this URL of the link, you will instead see Edit Hyperlink on this menu. If you select Link, a pop-up window will appear with the title Insert Hyperlink. This window will already be populated with the URL that you highlighted in both the address and the text-to-display fields. Assuming you entered the link correctly, you can leave the address field at the bottom as is. You do, however, need to update the text in the text-to-display field at the top. In this case, you might enter ATSDR's benzene tox profile. You then click OK to create a blue underlined hyperlink with that title, similar to what I just showed you on the previous slide. You can also use Word's link function to edit an existing hyperlink. Suppose you already had a hyperlink in your document, but you wanted it to have a different title or text. First, right-click on the existing link and then select Edit Hyperlink. A pop-up window will appear with the title Edit Hyperlink. The address or URL will appear at the bottom of the window, and the text to display will appear at the top. You can edit either field as needed. Public health documents also frequently incorporate equations. In general, equations are often read incorrectly by screen readers, making them inaccessible to those who do not see the equation. However, equations can be made accessible if they're converted to images and then described with alt text. ATSDR recommends creating equations using Word's formula function, and then the 508 coordinators will convert those equations into images by taking screenshots and pasting the images of equations into the document. You will need to write the alt text to describe the equation, similar to any other image. Like alt text for tables and figures, the limitation of this approach is that the alt text has to be equal to or less than 120 characters. If 120 characters are not sufficient to describe the equation, you can have the alt text refer the reader to an addendum where you can provide a more detailed explanation of the equation. This is the exact same process that I described earlier for alt text for tables and figures. Note that ATSDR's Office of Communication will convert equations to the images when creating a final 508 PDF. However, Health Assessors needs to set up the equations, assign equation numbers, and provide the alt text in a separate Word document. And if the alt text has more than 120 characters, place the alt text in an addendum to the public health assessment or health consultation. To add an equation using Word's equation feature, go to the Insert tab in the navigation window at the top of the window and click Equation. A menu of mathematical functions will then appear along the top of the window. You can then create an equation in the document using those functions. Once complete, add an equation number outside of the equation box and locate it to the right of the equation in the document. Let's go over one more time what to do when alt text has less than 120 characters or more than 120 characters. As I've stated several times now, similar to tables and figures, the Office of Communication will add alt text to equations when preparing the final PDF. However, health assessors need to provide the alt text. To do so, you should add alt text for equations to the same separate Word document that you prepared for submitting alt text for images, figures, and tables. Just like figures, you'll need to make sure that each equation is numbered in the public health document and then identified by that same number in the separate Word document with the list of objects requiring alt text. Similar to tables and figures, if a description for an equation is 120 characters or less, you can directly enter the description into the separate Word document. If a description is more than 120 characters, you will need to note See Addendum in that list. Then, open your public health document and create an addendum with the description of the equation. The preference is that alt text for equations should be 120 characters or less, providing enough detail for those unable to see the equation to understand it. For simple equations, like many of those used in the Public Health Assessment Site Tool, or FAST, you can probably describe the equation within these limits. For example, consider the equation for estimating water ingestion dose, D equals C times IR times EF over BW, where D represents the exposure dose, C is the contaminant concentration, IR is the ingestion rate, EF is the exposure factor, and BW is the body weight. This equation is shown on the screen. Useful alt text for this equation could be written as D equals C times IR times EF over BW, which is only 36 characters including spaces. It could also be expanded a bit to something like dose equals concentration times intake rate times exposure factor divided by body weight, which is 89 characters. Both options provide sufficient information to understand the equation and are less than 120 characters. ATSDR has written alt text for all of the equations in FAST. This resource will be found in a table that's available through the FAST resources page. Health assessors can use this tool to simply copy and paste alt text for relevant equations in their documents. For more complex equations, you may need to describe the equation in more than 120 characters to ensure that someone who can't see the equation is able to fully understand it. As I mentioned before, this is done by adding the alt text to an addendum at the end of the public health document. As an example of a complex equation that would be difficult to describe in 120 characters or less, I have included an equation from ATSDR's shower model on this slide. This equation estimates the absorbed dose per event for short-term exposures to organic compounds and includes 7 variables and numerous functions. Describing it in 120 characters or less would be nearly impossible. As such, in this example, you would want to create an addendum to describe the equation. The Word document that contains the list of tables and figures with alt text less than 120 characters would also list this equation 1, but it would tell the 508 coordinators to find the alt text for equation 1 in the addendum. To close on this topic, I'll provide a brief overview of some tips for creating accessible equations. If an equation has a subscript, add a space between the letter and the subscript. Be sure to number each equation in the document by placing the equation number outside the equation box and on the same line to the right of the equation. Create alt text that is 120 characters or less to describe the equation. In doing so, note that it's acceptable to use abbreviations in all capital letters, such as ADAF for age-dependent adjustment factor, as well as hyphenated words like ADAF-adjusted in alt text. Abbreviated units like milligrams per kilogram per day are also okay. If you can't describe the equation in 120 characters or less, place the alt text in an addendum to the public health assessment or health consultation. Include the equation in a separate Word document that lists all alt text, but refer the 508 coordinator to the addendum to find the alt text for the equation with more than 120 characters. And finally, save yourself some time and use pre-written alt text for the equations in FAST. That text will be found in a file saved on the FAST resources page. Now let's talk about lists. Lists are used to organize content in an understandable way. They help to break up and simplify text. However, if you create a list solely using visual formatting, such as pressing the tab key and using a dash as a bullet, assistive technology may not recognize it as a list. Properly formatting lists with Word's built-in tools ensures that screen readers can accurately interpret the groups and relationships conveyed in the list. As an example, I'll now play a recording of how NVDA software reads the lists on this slide, which was prepared using Microsoft's list function.
Samples were analyzed for the following. List with 4 items bullet. Volatile organic compounds, bullet. Polychlorinated biphenyls, bullet. Paran polyfluoroalkyl substances, bullet. Mercury out of list.
The screen reader begins by informing the user that the list contains 4 items. It then says bullet before each item, aligning the auditory experience with the visual format.
Samples were analyzed.
You can add accessible lists to a Word document by using Microsoft Word's built-in list feature. To do so, go to the Home tab in the navigation window and then to the Paragraph section. Select one of the list options, bulleted, numbered, or multi-level. Once selected, start typing your list into the document. Another way to do this is to begin by typing the first item of your list into the document, and then select the desired list type from the navigation window. It's always a good idea to check that lists in a document have been formatted properly. This slide displays screenshots of two lists in a Word document, both listing 3 contaminants of concern: arsenic, cadmium, and lead. The list on the left was manually created by typing several spaces and then a dash before typing each contaminant. When this list is highlighted, none of the list features are checked in the navigation window. This is an inaccessible list. In contrast, the list on the right was formatted using Microsoft Word's built-in list feature. When this list is highlighted or selected, the bolded list feature is checked in the navigation window. This is an accessible list. When adding lists, you should avoid using tabs and dashes to manually create the list. You should also avoid creating lists with more than 3 levels, as they can be difficult to follow for those using assistive technology. Similar to lists, columns should be formatted using Word's built-in features to help ensure accessibility for everyone, particularly those using screen readers. While columns are not generally used in public health documents, they can be a useful way to effectively format the summary section. This is the section where you map out conclusions, the basis for those conclusions, next steps, and contact information. When this section is formatted with tabs or as a table, it can be difficult for screen readers to interpret. ATSDR has developed an outline for public health documents, which is available on the FAGM resources page. This will be covered in greater detail in a future training, but I want to briefly mention it here because the outline uses Word's columns feature to format the summary section. I've included a screenshot of their summary section from that outline on this slide, with formatting marks turned on to show how columns and section breaks were used to create the necessary information mapping in an accessible way. Using this outline, you can copy and paste the rows shown here for conclusion 1 to include any number of additional conclusions. This method helps ensure that a screen reader provides the information in the same way that it appears visually on the screen. As I had mentioned, this will be covered in more detail in a future training. However, I want to let you know that the outline on the FAST resources page does have a summary section that's formatted to be 508 compliant. In summary, there are several best practices for accessibility that you should implement when preparing public health documents. When creating public health assessments, health consultations, or similar documents, you should do the following. Apply styles to titles, headings, and body text. Use Microsoft Word built-in features such as tables, lists, and columns. Use standard sans serif fonts, preferably Calibri 12-point. Ensure sufficient color contrast, specifically a minimum ratio of 4.5 to 1. Use a secondary feature when using color to convey meaning. Provide alt text for tables, figures, maps, graphs, and equations. And use simple tables without merged or split cells, rows, and columns, and designate a header. To wrap up this section, let's go through another knowledge check. For the following statements, select the correct answer. Alt text should be provided for non-essential images. The document structure does not affect 508 compliance. You should not use color alone to convey information. Complex tables with merged cells are accessible. Take a few seconds to determine the answer. Okay, the correct answer is number 3. You should not use color alone to convey information. People with visual impairments might not be able to see the colors. Therefore, it is important to incorporate additional information, including explanatory text, in all charts and graphs. Option 1 is incorrect because non-essential images should be designated as decorative and should not have alt text. Option 2 is also incorrect. The structure of a document needs to be clear and hierarchical for 508 compliance. A well-structured document can easily be interpreted by a screen reader and navigated with a keyboard. Lastly, option 4 is incorrect because accessible tables should be created in a simple format that avoids merging or splitting cells, rows, and columns. Now that we have discussed some best practices for creating accessible Word documents, I'll introduce you to several helpful tools. First, Microsoft Word includes an accessibility checker. This is a built-in tool that verifies the content of a Word document against a set of accessibility rules and guidelines, and then flags issues to resolve that will help people with disabilities. It runs automatically in the background and provides notifications as issues arise. Importantly, I need to mention that while Word's accessibility checker is a valuable tool, it may not catch every 508 compliance issue, particularly complex ones that require human judgment. However, it does effectively identify a number of key concerns and serves as a good starting point for making your documents more accessible. It will capture things such as missing alternative text for images, improperly formatted headings, or insufficient color contrast for text. To use this tool, navigate to the Review tab in the navigation window and then select Check Accessibility. Upon selecting Check Accessibility, an accessibility panel will appear on the right side of your screen. This is where you will see any errors or warnings. The image on the middle of this screen displays a screenshot of that pane. In this example, the accessibility checker flagged 3 objects that were missing descriptions. Clicking an error reveals a drop-down menu with recommended actions. In this example, the drop-down options allow you to add a description or alt text or mark the object as decorative. At the bottom of the accessibility pane, there's a box that says, "Keep accessibility checker running while I work." Checking this box ensures that the accessibility checker continues to run in the background as you work. ATSDR recommends that health assessors run the accessibility checker either while preparing a Word document or once a document is complete, and then address any errors that are flagged. This will help speed up the 508 process once the document is cleared. Another valuable resource that you can use to help ensure that your document is accessible is the Public Health Document Outline developed by ATSDR, which I mentioned briefly earlier in this presentation. This outline not only lays out essential content for public health documents, but it does so using formatted headings and styles. You can find a copy of this outline available as both a Word document and a PDF on ATSDR's FAGM website. Once on the website, locate the files either within the Putting It All Together page or within the Resources page. I'll show you how to find them on the Resources page today. After reaching the Resources page on the FAGM website, scroll down to the section titled Putting It All Together. Under this heading, you'll see options to download the ATSDR document outline in both PDF and Word format. ATSDR recommends downloading the Word file and then using that document when writing public health documents, including public health assessments, health consultations, and health consultation exposure investigations. I'll provide a quick preview of that outline today. Keep in mind that this document is periodically updated. This slide displays a screenshot of the 3rd page of ATSDR's public health document outline. I'll point out a few key features to highlight the utility of this document. First, the outline provides headings that cover all of the essential information for these documents. For example, this page shows the main topic of background, including statement of issue and purpose, and site description and timeline. It then goes into community description and concerns. You can use this outline to ensure that all necessary content, like this, is included. Second, ATSDR has formatted the headings and subheadings in this outline using styles, which we discussed earlier in this presentation. This formatting is critical so that those using a screen reader can effectively navigate the document. For example, background is formatted with heading 1, while statement of issue and purpose is formatted as heading 2. The main text is formatted with the normal style. Each of these styles uses a different font, size, and color. When creating this screenshot, my cursor was on the heading for section 2.1, Statement of Issue and Purpose. This section title is formatted with the heading 2 style, as confirmed when clicking within that heading, which flagged heading 2 in the Styles tab at the top of the window. ATSDR encourages health assessors to use this outline when developing public health documents. Additionally, ATSDR has created a checklist specifically for reviewing Word documents for accessibility. This checklist covers all of the standards and guidelines that we discussed today and will be available on both the FAGM and FAST resources pages. This checklist should be used to verify that you've addressed common accessibility concerns before submitting the final and cleared public health document to be converted into a 508 compliant PDF. While health assessors should follow the specific ATSDR guidance discussed in this webinar, this slide presents several other valuable resources. First, Section 508.gov provides guidelines and standards for ensuring digital content, including documents, is accessible to individuals with disabilities. This site includes written guidance and a series of instructional videos. Second, the U.S. Department of Health and Human Services, or HHS, has developed checklists that outline 508 requirements for different types of digital content. Although these checklists may seem complicated, they do include all the requirements for 508 compliance. Third, NCEH, or ATSDR's Office of Communication, has developed reference materials on accessibility, as well as hosted some related webinars, all of which are available on CDC's intranet. Before we continue, let's do one last knowledge check. For this, take a moment to think about 3 tools that can be used to help create an accessible product. Okay, here are some possible answers. Microsoft Word's Accessibility Checker, ATSDR's 508 checklist for public health documents, tools for analyzing color contrast, the table in the FAST resources page with alt text for FAST equations, the public health document outline in the FAGM resources page, and the HHS 508 checklist for various technologies. We discussed all of these tools in today's presentation. You can refer back to the PowerPoint slides to review the information that we provided about them. We've now covered all of the technical content for this webinar. Before we close, though, I will provide a brief overview of what we've learned. Section 508 of the Rehabilitation Act of 1973 requires federal agencies to make all electronic and information technology accessible to people with disabilities. This includes public health documents authored by ATSDR and Apple Tree Health Assessors, such as public health assessments, health consultations, and letter health consultations. Health assessors are responsible for preparing accessible Word documents, which ATSDR's Office of Communication then converts into 508 compliant PDFs. By following the best practices outlined in this webinar, you can do your part to help ensure electronic documents are accessible to all. Doing so has the added benefit of helping minimize time between when a Word document is finalized and cleared and then published as a 508 compliant PDF on ATSDR's website. With that, I would like to thank you for your attention and listening to this webinar. For more information, please reach out to your Associate Director for Science or your Technical Project Officer. Thank you. Thank you again for listening and participating in this webinar. At this point, we're going to move into a question and answer session. David Millard and Sandra Lopez Carreras from OC-DAPS, Tanya Burke and Lee Moores from OCHA, and Michelle Natali from the Office of Communication are all here on the line to answer your questions. Katie, can you please go ahead and get us started?
Absolutely. Great presentation, and thank you everyone who has submitted a question so far. As a general reminder, if you have a question, please do type it into that Q&A box, and you can direct your question to any of the panelists that we have today, or any specific thing that happened in the presentation. Additionally, if you'd like to ask your question out loud, we do have the raise hand feature on. We will be reading questions that were submitted already first, but if you want to ask your question out loud, we will call on you after we get through the written questions. So with all of that, I'm going to begin, and it looks like for the first question I have, I believe it was in reference to either knowledge check 2 or 3, but it was for Q2. Does it apply to non-certified documents created by Apple Tree States, like our soil shop pamphlet?
Um, Thank you for this question. I believe Q2 refers to whether an Apple Tree program needs to develop accessible 508 compliant documents, even those that are non-certified. Michelle, Natalie, would you like to answer this question?
Yes, if the document is prepared with federal funds, then yes, you have to make it 508 compliant. That's the rule of thumb. Everything made with federal funds must be 508 compliant.
Perfect. Thank you.
Great, thank you both. Next question I see is for equations in the download results files from PHAST, ATSDR advises in the recent TPT admin updates that the alt text should be provided for the equations. However, the screen reader in Word can read the equations just fine. In that case, is the alt text still needed since the alt text would be essentially what the screen reader reads?
Thank you. I believe that this question should also be answered by Michelle.
Yes. Just because it reads it in Word, it does not mean to say that screen readers read it. Also, every screen reader reads different things. So yes, you still have to provide the alt text so that we can cover for the screen readers that read and for the ones that don't. Plus, remember, the Word document will not be get posted on the web.
Yes, Michelle, I was thinking about that ultimately the document that everybody produces will be converted into a PDF.
That is correct, yes.
Okay. Thank you.
Great, thank you both. All right, next question is it appropriate to bold table titles and legends, or is it not recommended? And what's the minimum text size for table content? And then the last question is, what's a good strategy if the table is very large and to fit everything? This person says they have to present data for all exposure units, and the font size would have to be very small.
So my understanding is that font sizes between 10 and 12 are the best, but I want to make sure, Michelle, do you know about this?
Yes, you don't have to make them bold. That's not, you can or you can't, but they're not necessarily read as bold. As I say, each screen reader reads things differently, so you can. The minimum text size is normally about 12 points. Like Sandra said, 10 to 12. I wouldn't go any smaller. Now, when you're talking about a very large table, are you talking about width-wise, as in how many columns you have? If it's going to burst the page, so to speak, with lots and lots and lots of columns, then break it into 2 tables. So instead of having 24 columns, you have one table with 12 columns and the next table with 12 columns.
Perfect. Thank you.
Thank you. Next question is it possible to provide instructions for Apple Tree State personnel on how to access the CDC intranet links provided in the chat so they can access the training material later? Or are the links only for CDC staff?
Yes. Okay.
Sorry.
Okay, I'll answer that one. So not every person in the program has access to the intranet. However, the other resources that we mentioned are very good and complete. The website section 508.gov and the HHS checklist. They include everything that you need to know. But on top of that, we developed a 508 checklist, especially for this presentation and for the Apple Tree program. And the checklist will be posted in FAGAM and in FAST. Michelle, do you have something else to
Yes,
add?
if you don't mind.
Yes.
If anybody really wants any of the PDFs that I have, like how to remediate PowerPoints, how to build a Word document, how to fix PDFs, I am more than happy if you email me at yzx9@cdc.gov to send them out to the States.
That is fantastic. Thank you. That's a good offer.
All right, thank you. Let's see. Next question is, how do we make internal links within a document 508 compliant? For example, my document has a lot of tables, so I have to use or include internal links so that people can easily navigate to each table. Will this be a 508 compliance problem?
Yes, this question is best answered by Michelle as
Oh,
well.
I knew you were going to say that. Okay, so making internal links is quite a complicated process. Okay, so if you email me, I can email it to you. But if it's a link to if it's in the table and it's a link, it has to be blue and underlined like other links. And there is a way using bookmarks that you can do that. You can make an internal link. So yes, you do have to have the links. You have to have them showing as links, and you do have to make sure that they're 508 compliant that way. I can't remember how to do it off the top of my head right at this specific moment. I can look it up, and as I say, I can send it out if you want to, Sandra and David, to send to the list. I can do that way, or if anybody wants to email me, I can send them in an email.
Yeah, Michelle, if you send that to Sandra and me, we'll get it out to folks.
Okay,
Yes.
awesome, thank you.
So that came from Teresa. Teresa, are you talking, is this the same as cross-referencing, say, a table with the text? Or is this something different? Can we unmute Teresa so she can talk?
Oh, yep, I can give Teresa her microphone now if you would like.
So Teresa, there is a way to
Okay.
cross-reference a where a table or figure is mentioned in the text with the actual table and figure so that people can go back and forth very easily. You can do a YouTube search and find training videos in YouTube on how to do cross-referencing that would allow someone to go from, say, a paragraph to where that table is.
Okay, thank you.
Great, thank you. Let's see. Next one I see is, do acronyms and tables need to be spelled out in each table?
Well, it depends on what your acronyms you're talking about. I mean, just bear in mind when anything is in a capital letter, okay, it's read out as an individual. Like, for example, in this questions and answers at the top of the screen, if that was all caps, it wouldn't be read by a screen reader as questions and answers. It would be read as QUESTIONSANDANSWERS. So as long as you have the acronym, if it's a common acronym that everybody knows, a scientific acronym, that could be different. But if it's one that people don't know, then perhaps you could have the acronym in the table with an asterisk or something and a reference underneath as to what that stands for, just so that you can explain it.
Yes, I agree
Great.
with that answer. I think that we should spell out the acronyms at least once. Thank you.
So this is not necessarily a 508 issue. It's more of a writer-editor issue for what ATSDR requires. We generally say we want tables and figures to stand alone, which is why you would think about spelling out an acronym, even though you've established earlier in the document. But I don't think we require that at this time.
Yeah, it's more about clear writing, clear language. Thank you.
Great, thank you all. The next question I see is the overall format of a 508 compliant document noticeably different to the average user when viewing a document?
I can answer that. No, it is not. It looks exactly the same. The tags that we are talking about to make it 508 compliant are in the back end of the document that are picked up by screen readers and accessible readers. Now, the only thing you've got to be careful, as I say, you have to be careful about colors and things like that. That's the only thing that someone would see would be the different colors. But no, it is the exact same document. We don't alter anything at all. The tags are all behind the scenes.
That's a very interesting question. And I would agree that color is the most obvious thing. If it doesn't have color contrast, you can tell. But other than that, you cannot. Thank you.
Great, thank you both. And it looks like we're at the top of the hour and we have one last question. So the question is, are there any specific recommendations for the smaller text, usually footnotes, that usually follows a table? And is there a minimum font size? And how should that be set up?
So this is David. I've not heard of any minimum requirements coming from our writer editors. That's a good question. I think I'll send Tracy an email and ask her.
This is Michelle. The thing about the footnotes at the bottom, they're normally, the same 12 font size as far as I'm aware. But make sure that wherever you're referencing, like if it's number 1 and then there's a footnote of number 1 down below, you link number 1 to that footnote, number 2 to the 2 footnote, number 3 to the 3 footnote. Now in tables, the ones that you have following tables, like if, say, for example, in a table you have an asterisk and maybe you have 6 asterisks, you only internally link the first asterisk to that note and put each note, for example, asterisk on one line, dagger on the next line, double dagger on the next line, separate them into individual lines, because when they are all together in one large footnote with no spaces and no line breaks between them, they're exceptionally difficult to link to the correct asterisk, dagger, whatever.
That makes sense. And I'm thinking that if people have further questions and they need to see an example, we can send emails with different examples of all of these aspects in documents that are already 508 compliant. So let us know after, you have the contact information from Michelle Natalie, or you can contact me or David Millar, any of us. Let us know if you have additional questions, if you need some examples, if you need resources. We really want to help the Apple III program to make, your PHAs, your health consultations accessible, and make the transition from Word documents to PDFs very easily. That's it. Thank you, everybody.